Good morning and welcome to the Medic TV. I'm Putra Amira, a Foundation Medical Science student, and I'll be your host for today. Today, we will discuss about the skeletal system. Oh yeah, to this episode, we bring beautiful and smart speaker for all our studio audience. Okay, before we start, I would like to introduce all our beautiful speakers. We'll start with our first speaker, Dr. Mazina Jiha. For information, she is a lecturer in anatomy and physiology. And our second speaker, which is a student who always got 4 flat in her examination. For sure, it is I'm Sabrina. Then, we also have our intelligent scientist here, Professor Dr. Siti Sofia. And our last speaker, a very smart and humble rheumatologist, Dr. Kana Geswari, guys. I'll share with you what is skeletal system is. I would like to let all of you know one thing, yeah. Audience, here is some info for you to know. The Biomedical Technology Resources Center, the Case Western Reserve University Center for Multimodal Evaluation of Engineered Cartilage, is a platform for a multidisciplinary collaborative and service interaction and a broadly accessible resources for developing, for testing, for validating, and for disseminating new method for evaluating tissue engineered product. Why? Because the purpose of the center is to provide in one location all the technology and expertise needed to comprehensively evaluate engineered cartilage from cell, from the molecular biology, biomechanical, biotransparent aspect, all the aspects including our skeletal system. So now, let me tell you what is skeletal system is. System is our body central framework. It consists of bone and connective tissue, including cartilage, ligament, and also tendon. It's also called musculoskeletal system. For your information, there are many purposes of skeletal system. Besides giving us human shape and features, it allows us for movement. How? Because our skeleton supports our body weight to help us to stand up and move. Joint, connective tissue, and muscle will work together to make our body as a mobile part. Other than that, it will produce blood cell. This is because bones contain bone marrow. Remember this, bones contain bone marrow. Okay? Red and white blood cells are produced in the bone marrow. Not only that, the purpose of the skeletal system, what? Yes, to protect and to support organs in the body. How about store minerals? Yes, in one of the purpose of skeletal system, since bone whole body's supply of minerals like calcium and vitamin D, so we can say that skeletal system store our minerals. Guys, I think now is the time for us to begin with some introductory comment from our first speaker, Dr. Mazina Jiha, regarding the organs that related to make up the system. I will pass the mic to Dr. Mazina Jiha.
Thank you, IB, to the host. So now, hi and assalamualaikum everyone. I will proceed with the organs in the skeletal system. So in general, the adult human skeleton is made up of 206 bones, including the bones of the skull, spine, ribs, arms, and legs. Our skeletal system is made up of 2 main divisions, which are the axial skeleton and the appendicular skeleton. The axial skeleton is made up of skull, hyoid bone of the throat, ribs, sternum, and spine. Axial skeleton helps in providing support and structures. It then helps in providing support and protection for the brain, spinal cord, and organs in the ventral body cavity. The bones of the skull support and the structures of the face and protects the brain. There are 8 bones that form the cranial cavity, which includes the brain and serve as an attachment site for the muscle of the head and neck. Other than that, the skull also has the auditory ossicles of the middle ear that transmit sounds from the air as vibration to the fluid-filled cochlea. The auditory ossicles consist of 6 bones and are the smallest bone in the body. Apart from that, we also have 14 facial bones that form the face that provide cavities for the eyes, mouth, and nose. After the skull, we have the vertebral column. The vertebral column surrounds and protects the spinal cord, support the head, and acts as an attachment point for the ribs and muscle of the back and the neck. In adults, there are a total of 26 bones that make up the vertebral column, consists of 24 vertebrae, the sacrum, and the coccyx bone. Lastly, for the exoskeleton is the thoracic cage or the rib cage. The rib cage is the skeleton of the chest, including ribs, sternum, thoracic vertebrae, and costal cartilage. The rib cage protects the organs of the thoracic cavity, including the heart. Next is the appendicular skeleton. The appendicular skeleton consists of 126 bones that make up the upper and lower limbs, plus shoulder and hip bones that connect them. The pectoral girdle consists of the scapula and the clavicle. The scapula or the shoulder blades lie on the posterior aspect of the shoulder and are supported by clavicles, which also connect with the humerus to form a shoulder joint. The upper limb is divided into three regions, which are the arms or humerus, forearm, which is the radius and ulna, and the hand. The base of the hand contains 8 carpal bones, while the palm has 5 metacarpal bones, and the fingers and thumb contains a total of 14 bones called phalanges. Moving on is the pelvic girdle. The pelvic girdle is formed by a single bone, which is the hip or coxal bone, and serves as the attachment point for each lower limb. Each hip bone is joined to the exoskeleton by its attachment to the sacrum of the vertebral column. Lastly, the lower limb contains 30 bones and is divided into 3 regions, which is the thigh, leg, and foot. I think that's all from me on the organs in the skeletal system. I'll pass it back to our host.
Doctor, is it true that skeletal muscle can be developed using stem cells?
Thank you for the question. Actually, yes, the skeletal muscle can be developed using the stem cell. In fact, a team of scientists from UCLA has developed a new strategy to efficiently isolate, mature, and transplant skeletal muscle cells created from human stem cells, which can produce all types of cells in the body. This finding helps a lot in our healthcare system as it paves the way for the stem cell replacement therapy for muscle disease such as the Duchenne muscular dystrophy. This disease affects approximately 1 in 5,000 adolescent males in the US and is considered the most fatal childhood genetic disease. Well, I hope it answers your questions.
Yes, really answered my question. Thank you so much, Dr. Mazna Jiha, for the knowledge. Now, I would like to invite our friend, Ami Sabrina, an orthopedic student, to explain the function of organs in the skeletal system. Ami Sabrina, the floor is yours.
Alright, thank you, Ibit, to our energetic host, Putri. Also, thank you everyone for giving me a chance to talk here today. How are you guys? Are you guys doing well?
Alhamdulillah, fine.
Alright, good. So, as our moderator said, we are going to let you guys know more about our skeletal system. In my talk today, I will be talking about the functions of the organs within the skeletal system. But before that, may I introduce myself a bit first?
Yes, sure.
Alright, thank you. So, hi everyone, I am Aimi Sabrina binti Roslan, an orthopedic student from Management and Science University. Alright, I guess that's a very simple introduction, right? It's okay. So, back to our topic, functions of organ within the skeletal system. Recently, increasing studies have revealed that the skeleton contributes to whole body homeostasis and the maintenance of multiple important organs or systems such as hematopoiesis, immune activity, energy metabolism, and brain function. These functions affecting non-bone tissues that are called extraskeletal functions. Did you ever know why most of our body system is hard and bony? This is actually because they are mainly formed of bones. These bones form a framework in our body. What is the name of this particular bone? They are called skeletons. These together make up the skeletal system. Obviously, the skeletal system really protects our body, right? And for your information, a skeleton is made up of different types of bones, which are skeleton, skull, backbone, ribcage, and hip bone. So now, I will be giving you some important information that you have to know about each type of bones. First, I will start with our skeleton. Skeleton give our body shape and support. Also, bones are hard and strong, so they do not bend. Not just that, the skeleton also protects the soft and delicate organs inside our body from injury. Our skeleton is made up of bones with different sizes and shapes. There are 206 different bones in our body. There are some points that you should take note of. First, you should know that our bones of head, shoulder blades, and hips are made up of flat bones, while the bones of our arms and legs are long bones, and the bones of our palms and feet are short bones, and last but not least, the bones in our backbone or spines are irregular bones. Then, the skull. So, I am very sure that you have heard this word before, right? But did you really know what is the main function of our skull? Okay, let me tell you. You just have to remember this one function of the skull, which is our skull mainly protects our brain. That's it. Besides, let's move on to our next type of bone, backbone. So what does our backbone do? Actually, our backbone also plays an important role in our body. Our backbone protects the spinal cord as the spinal cord, a delicate organ, is enclosed in the backbone. Furthermore, I am pretty sure that you have heard about ribcage, right? So, what is actually the function of our ribcage? Our ribcage is the bone that protects our lungs or our heart. And our heart. Simple, right? Yes, you only have to remember this one point for our ribcage. And lastly, hip bone. As usual, every single bone in our body plays a crucial role, right? So, let me tell you, what is the role of our hip bone, okay? It is as simple as ABC. Our hip bone protects organs like kidney and bladder. Additionally, have you ever thought about what makes our movement possible? Okay, so actually our muscles are attached to our skeleton, and this makes our movement possible. The skeleton also helps in blood cell formation. This is because the long bones of the skeleton contain a cavity filled with soft fatty material called bone marrow.
I mean, sorry for interrupting.
Yeah.
But why like that?
This is because blood cells are mainly made in bone marrow.
Now I understood. Okay. Thanks, Amy.
No problem, since I think you guys really understand now. So thank you for lending me your ears. Now I will pass the floor back to our beautiful host, Putri. Thank you.
Wow, beautiful host, y'all. Okay. Now I can understand why you always got 4 flat in your exam. Because the way you delivered the information was really clear and detailed. But now I'm still wondering, what is the relationship between skeletal system and the other system? Professor Siti Sophia, can you explain to us regarding this?
First and foremost, thank you to our beloved and cheerful host, and a very pleasant morning to everyone attending today. My name is Sophia, and I am beyond grateful to be given an opportunity to speak in our Med Talk today. So, regarding our topic about the human skeletal system, I will be explaining further about 3 things, which is the musculoskeletal system, common musculoskeletal disorder, and how to maintain a healthy musculoskeletal system. So, without wasting any more time, I'll be giving a short brief on what is the musculoskeletal system and the musculoskeletal relationship. So, as we all know, our skeletal system is closely linked to the muscular system. Let me explain further. Our skeletal system is formed by many bones from both the axial and appendicular skeleton. It includes all the bones and joints in our body. Let's take a look here. As you can see, the tendon creates movement, while the bone gives the shape to the body and supports body weight. Meanwhile, our joints, ligaments, and cartilages hold bone in place, absorb external force, and supports movement. Not only that, the skeletal system acts as a scaffold by providing support and protection, as well as helping us move well. But we know that bones don't move magically by itself, right? So with help from our muscles, which works in pairs, the flexor and the extensor, they make our body movements possible by contracting and then relaxing. For an example, the flexor contracts to bend a limb, like how you bend your knees and elbows. So when the skeletal and muscular system work together simultaneously, that is why it is called the musculoskeletal system. Next, I'm going to talk about the common musculoskeletal disorders. Let's go through it together, shall we? First, I'm very sure everybody heard of arthritis, right? This happens when your joints become inflamed and worn out due to aging, which makes you unable to absorb vibration or external impact during movement, which causes very painful experiences. Secondly, we have the tendinitis, which is caused by inflamed connective tissues. And the third one, epicondylitis, or also known as the tennis elbow. People who usually play tennis or badminton usually suffer this condition due to overuse of the muscles of their arm. So the question is, how do we maintain it? Although many people develop musculoskeletal disorders due to aging and injuries, we can still try our best to maintain our musculoskeletal health by exercising, having a good rest, and consuming healthy and balanced meals.
Oh, like that. Very interesting explanation, Professor. However, I have a question regarding your explanation just now. Is there any specific exercise that all age can practice to maintain musculoskeletal health? Please do give an insight, please.
Yes, that is actually a good question. Thank you. So, guess what? According to a study carried out by Ruth McCaffrey and Juyong Park from Florida Atlantic University, the most common group to experience musculoskeletal and joint disorders are people over 50 years old. That means as you grow older, your health will start to decline very, very slowly. So it may start with a simple back pain or cramps to a downward spiral of frustration, insomnia, stress, and obviously worsening pain. And you might have guessed, aging people do not prefer rough exercises because it only adds in the pain. So, yoga as an effective therapy for musculoskeletal pain and disability even for all ages. Why? It is perfect for people who are looking for a relaxing and a fun exercise. Not only that, yoga can also improve your posture, increases your flexibility, and greatly increases your blood flow and keep diseases like back pain and arthritis at bay. This is because yoga is a combination of mind-body movement that involves strengthening and stretching poses. So while it benefits our physical health, yoga also acts like a meditation exercise that calms the mind. That's all from me. Thank you.
Awesome. Thank you again, Professor Sophia, for the valuable input that you share with all of us. Guys, now let's invite Dr. Kanageswari to share with us regarding the types of disease that she knows related to the skeletal system.
Okay, hi Putri, thanks for the great welcome. So first off, I would like to thank Medic TV for inviting me here to share my thoughts about this topic. So in my time working as a rheumatologist, I've seen plenty of patients come in with various types of diseases related to the bone. So some of these diseases are fairly common, others not so much. So one of such common diseases would be osteoporosis. So this disease is commonly known to affect the older population, especially women, and patients diagnosed with this condition have low bone mass and density, which makes them easily susceptible to breaks or fractures. So the other common disease related to the skeletal system includes rickets. So this is a disease that is known to affect children due to the vitamin D deficiency, and the lack of vitamin D doesn't allow them to fully absorb calcium and other important nutrients that make their bones stronger. As a result, their bones are soft, weak, and often curved. Any child of Asian, African, or Middle Eastern origin is at a higher risk of having rickets, as skin with more melanin requires more vitamin D, especially if they are born into poverty and don't have the proper resources to a good diet. Another disease that is well heard of is scoliosis. In layman's terms, scoliosis is the sideways C or S-shaped curvature that is found on the vertebrae and most commonly diagnosed among adolescents. So there are many types of scoliosis, but the most common one would be idiopathic scoliosis. So the term idiopathic defines that there is no definite cause, but it affects almost 8 out of 10 people and has a tendency to run in families. In Malaysia, there was also a study carried out in March of 2017 called the Clinical Effectiveness of School Screening Program for Idiopathic Scoliosis in Malaysia by the Malaysian Orthopedic Association, where they found out that the prevalence rate for scoliosis were almost 2.25%, while the positive predictive value was a staggering 55.8% among those who participated.
Kana, sorry for interrupting you, but I have a question. Did you ever face any rare disease diagnosed?
That's a good question. Well, I think the most rare disease I've seen happened while I was still at medical school. We had a patient come in who had irregular bone growth, and the outer layer of the bone had thickened and almost had a dripping candle wax type image on x-rays, along with other swelling and pain symptoms. So in the end, the patient was actually diagnosed with malarioscosis, which is a rare disease that affects the bone and soft tissues and causes the thickening and calcification of the bones. So for this disease, there is actually no standard treatment, and treatment options are based on individualistic symptoms that occur to each patient. And the aim here is to relieve the pain and restore the movement of the patient. So physical therapy can be done to relieve the pain and improve the range of motion. Other palliative care that could be given to these patients includes the biphosphonate pain medication as well as nerve blocks. And finally, surgical options are also available, but there is a high chance that the deformities can reoccur.
Oh, okay, I see. Thank you so much, Dr. Kana Geswari, for sharing with us, and thank you too for answering my question. So guys, with the last word by Dr. Kana Geswari, we have to wrap up our conversation today. But thank you so much all our speakers for being here and sharing your valuable advice. Thank you too to our studio audience, and hopefully to see all of you soon. See you on next episode. Have a great day. Assalamualaikum. Thank you. Bye.
Bye-bye.
Bye.
Bye.
Tak sabar.